Hello, everyone, and welcome to our session on highlighting the opportunities that lie in the improved cooperation between water, food, and public health sectors. My name is Bassel, and I'm a research scientist at the Texas A&M Energy Institute, where I lead its Convergence Research Incubator, and I'll be your moderator for this session. I have the distinct pleasure to be joined with Jennifer Sara, the Global Director of the Water Global Practice at the World Bank, who will be co-moderating this session with me. What is happening in our world at this very moment as we face this historic global pandemic is a very bold example of the complex and interconnected challenges we must expect to address as we move forward into the future. Addressing such challenges will require the development of research that cuts across different disciplines and innovates at their interfaces. It will also require the active participation of multiple stakeholders from governmental, industrial, private, and public sectors. So our readiness really to rapidly and have a rapid and coordinated response to addressing such complex challenges will depend on our success in creating an environment for cross-sectoral cooperation through ensuring that we have the necessary infrastructure and mechanisms that enable and catalyze such cooperation and coordination to happen across different sectors. And doing so is not easy. Multiple barriers do exist for this cross-sectoral cooperation to happen. These include differences in planning horizons, differences in languages across sectors, lack of coordinating platforms and financing mechanisms, differences in governance models, among others. In our session today, we will focus on highlighting key opportunities for overcoming these barriers and implementing innovative levers for improved evidence-based decision-making and cooperation between the water, food, and public health sectors. We have an exciting lineup of speakers today to address these questions and to highlight potential opportunities. We are pleased to have with us Professor Christine Mo from Emory University, who will be our keynote speaker for this session. We will also have regionally and thematically diverse presentations by Professor Virender Sharma from Texas A&M University, Dr. Yilin Zhuang from University of Florida, Dr. Asaya Akoteyon from Lagos State University in Nigeria, as well as Professor Neil Grigg from Colorado State University. Before moving to our keynote speaker, I'd just like to go briefly over some housekeeping remarks. Just to remind all our speakers, this session will be recorded or is being recorded. We invite you to submit your questions in English via the Q&A button throughout the session. You can find this button at the bottom of your screen. We will try our best to address as many questions as we can right after the keynote speech and in the Q&A session following the presentations. As we have a huge audience, if we don't have time to answer all your questions that we will receive over the next 90 minutes, we will aim to collect written responses from presenters to place them on the conference website following this event. Please note that the chat box is disabled during this session. However, we ask you to keep an eye out for any useful messages that may be shared in this box from organizers and moderators. If you experience any technical problems, please Google Zoom Help Center or send an email to online.conference@iwra.org for assistance. And now, is Christine with us online?
Christine is not joined yet.
Okay, so we'll move the keynote presentation until later, until Christine joins us, and we'll start with our presentations for today. So we will have 4 speakers give 10-minute presentations each. After listening to the 4 presentations, we will have 10 minutes dedicated to answering the audience's question. We encourage all attendees to ask questions in the chat box throughout the session, and we will not have a Q&A after each speaker, but after all 4 speakers are done with their presentations. So our first speaker for today is Professor Virender Sharma. He's the director of the program of the Environment and Sustainability and professor at the Department of Environmental and Occupational Health in the School of Public Health at Texas A&M. Professor Sharma will be presenting to us on agricultural practices by enhanced water quality through iron-based technology. The floor is yours.
Good morning, good afternoon, good evening, and thank you for the opportunity to speak in this conference. I truly appreciate. I never attended this conference before. Bassel, I have 10 minutes, right? That I understand. Okay. So I just move with this one, and I will. Yes, thank you. Basically, I want to convey the use of ferret in improving the water quality, and then it will have benefits in agriculture field. So I try to make a case. I'm a water chemist and a water sustainability person. And I thought just to attend this conference, I will learn a lot. And this was my intention to learn, is forcing myself to give presentation too. So I always be in the meeting. And with this is ferret 6 is a high oxidation state of iron. And I'll just explain what that means. It has many applications, oxidation, disinfection, coagulation, and that coagulation release iron 3. So what that means in terms of agriculture, water or soil, after treating the water, it can be used for agriculture, and then agriculture treated water will not have any bacteria and virus that create nice biosolids. And then at the end, we have iron, and iron is healthy for the soil, so increase the quality of the soil. And that's my intention or thinking about how this technology, ferret 6, which have been working for a long time, it can be used for agricultural field. With this, I'll give some examples and tell what ferret means. Next, please. Next slide. And you know, iron rod has some 8 electrons outside the orbital. And once you start taking electron out, then you get different forms of iron, like some iron ore, ferrous oxide, ferric oxide like iron rust. And then if you take more, then become 4 and 5, and then at the end is 6. So if you're taking too many electrons out of it, that basically it becomes kind of, I try to say, it's angry iron. That means he's looking for money or looking for his electron. So whichever get in touch of these ones, then grab the electrons so it can go back to its original state, or it go back to rust. And doing this process, it destroy the chemicals, it destroy the bacteria, viruses, because looking for electron. And what I'm trying to tell, next slide, please, that it can be used as a disinfectant. Right now, the world is facing the pandemic, and then it can also clean the viruses and some bacteria at very short time. And that's like this is MRSA, E. coli, and Clostridium difficile. And you know, there's many deaths in the United States from this difficile spore, and we can do 6-log reduction in just 2 minutes. And why you don't see the market yet? Because we are seeking the approval from EPA before you can use. Next one, please. I see the notice in the chat. Somebody has problem listening, hearing me. Bassel, you can hear me fine? Okay, thanks. So this is the example also showing that ferret is a virus. It can really damage the virus, so it cannot come back. Because some technologies, you see chlorination, it can come back. But here is, once it goes there, it destroys the genes and proteins, so it cannot come back. Next slide, please. And this is just to show the other examples in Yosemite National Park, where there are some people got sick, visitors, and that is used to marine norovirus. This is the other kind of virus, and we have demonstrated using the ferret, which is again where lacking the electrons, looking for electrons, they attack that virus and then basically go decrease very quickly, these ones. Thank you. And next slide, please. And this is this is very much pertain to the agriculture practices because we start seeing many pharmaceuticals and it's antibiotics in the environment, in the water. And you know, especially in the United States, we spend 330 billion just on medication. Is going to keep increasing, not in the USA, but in all over the world, because we live longer and we really overuse these ones. So at the end, it end up in our water, and our water system is not ready to treat these pharmaceuticals and antibiotics. And once we use, because those conventional those are not really built to treat the antibiotics or treat the pharmaceuticals. So these we have real problems. And normally when we use these pharmaceuticals, more than 60% come out from the human urine and then end up in our water. And so what we are saying is in terms of ferret technology, that you can use ferret to destroy the pharmaceuticals, and the urine that has urea. So fortunately, or the chemistry works such a way for ferret, it does not attack the urea, but it attack the pharmaceuticals. So we can remove the pharmaceuticals, but keep the urea. So after the treatment, we can recover the nitrogen and phosphorus. For that will be good fertilizers. So that's the big goal, and that was funded by National Science Foundation. And we got really good results. When I say good result, means chemistry of ferret is basically enhanced by the constituents of the urine. So urine tend to be massage the chemistry such a way. So instead of removal of pharmaceutical in several minutes, it takes only a few minutes, so it can be done in seconds. And that's why this technology will be coming to clean the urine and recover the nutrients. Next, please. And this is just to demonstrate one more time why I'm interested in this one, because according to World Health Organization new report, there's an antibiotic resistance crisis in the country, and antibiotics are not new coming out in the market because there's no profit there. Like the same thing, virus was developed at the last minute, some vaccine. Same thing, I think we are kicking about time-wise about new drugs or new antibiotics. So according to WHO report, one of the biggest global health crises of the century is antibiotic resistance bacteria. And what ferret is really showing that it can remove all antibiotics in scale of seconds. Next one, please. And this is not only remove organics or antibiotics, it can also remove metals like arsenic and cadmium and nickel in water before you really applying the water for reuse in agriculture field or even for any other purposes. So it can also remove metals. Next one, please. So basically, I try to give in a very short format some flavor of how RNA-based molecule, which I've been working for a long time and can be applied to clean the water, which remove the bacteria, viruses, and metals and antibiotics. And that water can be used in practices in agriculture field. So now I start thinking about new thinking, and if you have an interest, you can discuss with me. Can we use this molecule of ferret to replace the organic B molecule which are toxic as a pesticides? So instead of using pesticide, we can just use ferret as a substitute for pesticides to remove some disease from the plant. So these are my collaborators, and then the National Science Foundation for its support for my research in this area. With this, I thank you everyone for giving me opportunity, and happy to answer any questions later or now. Thank you. Is okay,
Thank
right?
you.
I
Yes,
see
thank
you. That I need to stop.
Thank you, Dr. Sharma, for this presentation and for giving us an example of the potential applications of ferret technology and iron-based molecules, which can be applied to clean water and with potential uses for agriculture, with also a potential impact on health. So thank you for this presentation. And again, I would encourage all of our attendees to put in any questions they have for Dr. Sharma in the Q&A button so that we can address those in the Q&A session at the end. Our second speaker for today is Dr. Yilin Zhuang, who is the Regional Specialized Agent working with water resources for the University of Florida Extension Central District. Dr. Zhuang will be presenting to us on enhancing well water safety through university and health department partnerships. Dr. Zhuang, the mic is yours.
Thank you, and thank you for the introduction. So hi, everyone, and greetings from Florida, the Sunshine State. I hope I can bring some sunshine to your day. And as introduced, my name is Yilin Zhuang. I'm a water resources regional specialized agent with the University of Florida. I'm very excited to attend the 2021 IWRA online conference. And today I'm going to share some opportunities on how to enhance well water safety through university and health department partnership. So next slide, please. So when you think of Florida, so what's the first image came to your mind? So if I'm guessing right, probably you're thinking of beaches, theme parks, or some urbanized areas. So today I'm going to show you a little bit a different side of Florida. So believe it or not, 30 counties out of 67 counties in Florida are designated rural counties, and there are more rural areas in state of Florida. An estimated 2.5 million Floridians rely on private wells for home consumption. It translated to about 12% of the total population. Different from public utility water, private wells are not regulated. The management and the protection of the well water safety depend on private well users. On the other side, there's a very limited public data on how many well users regularly test their well water or they drink from contaminated wells. Next slide, please. And on the other side, it's the septic systems. So most private well users also use on-site disposal systems, aka septic systems. So here is some statistics. Nearly 1 in 3 households in Florida depends on septic systems. So more than 2.5 million septic systems are in use across the state of Florida. And the basin management action plans have identified septic systems as a major source of nitrogen loading to the impaired water bodies. Next slide, please. So therefore, the University of Florida Institute of Food and Agriculture Sciences Extension is developing the Florida Well Owner Network. So there are 3 major goals of the Florida Well Owner Network. A is to educate residents about well water quality and quantity and the best practices to ensure well maintenance and groundwater protection, because this go back to private wells are usually not regulated. So the protection and the management highly depend on education rather than regulation. And the second goal for this program, Florida Well Owner Network, is to facilitate access to well water testing and provide information about the treatment options if problems are found, which you can also see next slide at the end, why facilitate access to well water sampling is critical. And the third goal for this program is we don't want to duplicate efforts. We would like to complement efforts by the Florida Department of Health and the Florida Department of Environmental Protection, because they are the permitting and the regulating agencies. They've already have some documents or some educational materials. So we would like to partner with them and to promote, to increase awareness among Floridians about the best practices regarding wells, septic systems, and drinking water quality. Next slide, please. So in the next few slides, I'd like just to share one pilot study we did. It's in Marion County, which is a county in Central Florida. From this map, you can see at least 1/3 of residents, they rely on private wells for their home water consumption. And no difference from other counties, no baseline well water quality data exists. The only existing data is after Hurricane Irma, the University of Florida collaborated with Virginia Tech and offered emergency water testing. And for Marion County, we collected 19 usable water samples and reviewed 26% of bacterial contamination. Next slide, please. So what we did is to collaborate with local health department, because health department is the permitting agency, is the regulating agency for wells, well constructions. However, they don't have the labor, they don't have the staff to offer educational material, education, nor water testing. So what we did is we obtained a mini grant of funding from the local health department for 2 years and enabled this monthly 2-hour seminar related to well water and the basics of wells. And after this program is to provide a free water testing for bacteria and optional test for lead and nitrate at a reduced cost. After they attend the class, they receive the kit and they submit their water sample. Once I receive the result, we offer this one-on-one result interpretation, let them know what it means, what can cause that, and what they can do to eliminate the risks. Next slide, please. So just want to show you some preliminary results of this 2-year educational program. I call it 2-year, actually, we were only able to do for 16 months, because in the middle of that, it was the pandemic. We were only able to do online classes and not able to provide the sampling. So this is, all the results was within that in-person time period. So total 371 people participated in this educational program, and we collected 214 usable samples and detect 18% of samples for bacterial contamination. And all of them, they took the recommendation to shock chlorinate the well through their wells and plumbings to kill the bacteria. Next slide, please. And some interesting information from the survey we collected for these 214 samples. So 64% of them indicated they don't know their well information. So they don't know what kind of wells they are using, the depth of the well, or the diameter, or the year the well was constructed. And 65% of them revealed they had never tested their well water until this educational program. So among these people, among the 214 people, 65 never tested, 73 indicated even they didn't test that, they're still drinking their water from the tap without any treatment. I want to just mention here, it's not saying the water is contaminated, but without treatment, but it definitely increased the risk. There's a risk there without knowing the water quality, and they still have the great confidence their water is safe to drink. And something else is also related to septic systems. All the well users in this program, they have septic systems. So 44% of them indicated they have never pumped their septic tanks. And 3% of them indicated they only pump their tanks when there's a problem. So next slide, please. So just some looking forward. So we had a great partnership with the local health department, and we are seeking more partnerships. So far, we have we established partnership with some local health department in the Panhandle, Florida Panhandle area. We also established a partnership with Water Management District. We would like is to seek more partnership and enable this model, the Marion County model, in other counties and build the capacity of well sampling. Something also learned from COVID. That's why we are conducting its hybrid or hybrid programs, which we teach the program virtually, and then we organize an offline water sampling event. And also some areas, because of the bandwidth issue, we will offer some in-person workshops and sampling event. And we also like to create more extension materials and develop a centralized website to house the materials and advertise environment, the events. Next slide, please. And with that, I look forward to taking your questions and comments. Thank you.
Thank you very much for the presentation, and thank you for sticking to the time. And thank you for giving us an example of how partnerships between universities and communities could improve the safety and health of these communities, and the role of engagement and community engagement in general, and the role it could play in improving the safety of these communities. Again, if you have any questions to Dr. Zhuang, please add those to the Q&A, and we will address them at the end of the session. Our third speaker for today is Dr. Akoteyon from the Department of Geography and Planning at Lagos State University in Nigeria. Dr. Akoteyon will be presenting to us on challenges of persons with physical disabilities in accessing water, sanitation, and health, and its implications on sustainable universal health coverage, with a case study from Nigeria. The floor is yours. Can you please unmute? Yes.
Okay. Thank you, the host and my co-presenter. My name is Isaiah Akoteyon from Lagos, Nigeria, Department of Geography and Planning. I will be presenting on challenges of persons with physical disabilities in assessing water, sanitation, and hygiene, implications for sustainable universal health coverage. A case study from Lagos Metropolis, Nigeria. Next slide, please. According to United Nations 2006, a person with physical disability are people with physical, mental, intellectual, or sensory impairment. And based on statistics, WHO 2011, it is estimated that about 1 billion people in the world are living with disability. And 80% of these people live in low and medium income countries. Therefore, disability is a major concern globally. And because of this, this study becomes very important in this part of the globe. And the Sustainable Development Goal, number 6, emphasize on the availability and sustainable management of water and sanitation for all as a major reference to disability. Next slide, please. Therefore, in Africa, disability is a major public health problem, And it is estimated that about 15%, 0.3 of this is common in Africa, according to World Bank. Therefore, access to water, sanitation, and hygiene is very important and is a key component of living a healthy life, according to the author cited. Poor access to water, sanitation, and hygiene have a significant health and social impact on human population. And so this discourse is very, very germane and important. A part of the major challenges faced by people with physical disability include discrimination and exclusion, and this tends to worsen the difficulty in accessing water, sanitation, and hygiene based on the WHO 2011. Next slide, please. The study area covered 3 major local governments in Lagos Metropolis, Agege, Lagos Mainland, and Surulere. This area are noted for a majority of the physical disabled persons, and there are more of these people in this area. And so the choice of the study area is very relevant for the study. And based on the location, which is Lagos Metropolis, this accounts for about 37% of the total landmass of the state. And the average population density is about 20,000 per person per square kilometer, according to Ilesomi 2010. Next slide, please. The data for this study focus on persons with physical disability in assessing water, sanitation, and hygiene facility, and random sampling technique was adopted to select the LGAs, which are Agege, Surulere, and Lagos Mainland. 50 structure questionnaires were administered across each of the local governments, totaling 150, using a systematic approach. Descriptive cross-tabulation and factor analysis was employed for data analysis, and the disability, the ICF methodology was employed to assess disability. Results were presented using chart tables, while map of the study area was produced using ArcMap 10.3.1 to generate the study map of the area. Next slide, please. The results from the study conducted on the person with physical disability, the result clearly shows that majority of the respondents were male, and the age of the respondent ranged between 30 to 39 years. And 51.3% of these respondents engaged in alms begging as source of livelihood. Approximately 42.7% of them live in public buildings, and this shows that they really do not have a place of their own. The majority of the respondents are crippled, and this shows the major cause of their disability, and this is attributed to a natural occurrence. A greater proportion of the respondents, representing 64% of the respondents, lack access to water, sanitation, and hygiene. And about 28% claim to have difficulty in accessing wash. And this is a serious scenario. In terms of the adequacy to water, sanitation, and hygiene facilities, 86% of the respondents claim there is high inadequacy of wash amenities. Next slide, please. Next slide. In the order of 65.3, 30%, and 4.7%, the respondents rated their satisfaction in terms of the quality of service delivery of wash as unsatisfactory, fairly satisfactory, and satisfactory respectively. The factor analysis employed shows 5 main components, and these account for 73.48% in the data set, and the 5 main factors were classified into 3 major types. These factors are accessibility factor, which relates to distance cover, time taken, and waiting time to access water. The second factor is social factor, which includes low esteem, verbal abuse, and limited privacy. And the last factor that was extracted by the factor analysis is the design factor. And this includes difficult staircase, weight of container, and slippery floor. Factor 1, which account for 19.57%, has a high loading on the waiting time and weight of the container. Next slide, please. The second factor, which is factor 2, accounts for 17.81% with positive loading on low esteem and verbal abuse, while difficult staircase, wet or slippery floors, and limited privacy account for 16.31% and is the factor 3. The factor 4 has a high loading on distance and time taken, and it accounts for 9.92% of the variance. In terms of the design factor, only one of the variables is significant here, and these account for 9.89% of the variance in the data set. Respondent coping strategy indicates that majority of the respondents, these account for 96.6%, and 73.3% depend on family members, neighbors, and machines to access water, sanitation, and hygiene in the study area. 50% of those people prefer to remain silent as a coping strategy. This calls for a concern. Next slide, please. The implication for this study is clear. One, the outcome of this study will provide database on persons with physical disability in Lagos metropolis as it relates to WASH. It will also serve as a baseline information for policy guideline and infrastructure/technology design that will enhance access to WASH facility with persons with physical disability for improved healthy living conditions. The study concludes by suggesting that accessibility, social, and design of amenity factor are responsible for the challenges of persons with physical disability in the study area. And I recommend investment in WASH infrastructure that will reduce and eliminate physical barrier in accessing WASH. Thank you.
Thank you very much, Saya, for your presentation and for shedding light on challenges and inadequacy of WASH amenities, especially for persons with physical disability, and the importance of investing in such infrastructure. Thank you very much for your presentation. Our last speaker for today, before we move to our keynote speaker, who I see just joined us, we have with us Professor Neil Grigg, who is the Professor of Civil and Environmental Engineering at the Colorado State University. Professor Grigg will be presenting to us today on breaking organizational stovepipes, connecting water, sanitation, food, and public health. The floor is yours.
Thank you, Bassel. I hope you can hear me all right.
Yes, we do.
Yeah, thank you. It's a great privilege to be here today. And I'll say hello, like Yilin did from Florida, sunny Florida. This is colorful Colorado. And I'm speaking from Colorado State University, where for many years we've had a concentration in water research of different kinds. And one of the things that we're finding here is that the emphasis is shifting from narrower research that would focus on technical topics such as my engineering friends into the broader field of the systems, the different approaches to one water, the nexus, and things like we're discussing here at the meeting. And what I want to explain is a little about these organizational stovepipes, which are inhibiting a lot of the progress that we need to make in integrated water resources management and One Health. And I think the presentations we've seen so far at the conference have given us a lot of good examples of how you can break these stovepipes. They have to do with bureaucracy, with politics, with incentives, with human behavior, and all of the things that keep us from making more progress. On the one hand, we have a lot of great scientific solutions, but if we are not able to implement those, we can't move ahead. Another point which is clear to me is that we have a terrific number of conceptual frameworks that they make a lot of sense, but until you look at real world examples down at the ground level, mainly at the local level, you really don't understand what's going on. So my presentation focuses on the nexus of systems diagram that you see right here, where the centerpiece is health. Health is a wonderful integrating sector for water, food, sanitation. Governance drives everything there. There's a lot of external drivers you see on the left. And what we're looking for is positive outcomes in terms of health, disease, and so on. Next slide, please. Now, in order to explain what we are talking about, it's always a great idea to have the big picture in terms of what the major problems are. A lot of what I'll present here today is more like what you'd call social science tools rather than engineering or technical tools, because I found them to be extremely useful to explain what we're talking about. And the DPSIR framework, which was generally developed by Elinor Ostrom, who was an economist, is very useful. I won't take the time to go over the whole thing, but if you look at the drivers, the pressures, the states, the impacts, and the responses, you see DPSIR. And under responses, you see integration, which I circled in the red, because this is what we're looking for. If we're going to break stovepipes, that's the key to integrating our responses. And again, figuring out how to do that in local situations is the main issue. Next slide, please. Now, there's a lot of good systems diagrams. This is one that I prepared myself. All of these systemic effects that we have in the nexus frameworks and integrated frameworks, extremely complex. Everyone knows that water is not a sector by itself. It's a connector of many sectors. Again, this is too complex to go over in detail, but if you just track it from the left to the right, you'll see how we can go from the pollution that enters our system, drivers like climate change, the water connected to the other environmental components, water as an exposure media, and it has different sectors like over the ones you see, water management, different ways that water can be a pathway to different types of disease through these pathways with different outcomes. So unless we attack this holistically, we're not going to have a good pathway ourselves to come up with feasible solutions. Next slide, please. Now, this is a conceptual model that I developed just to illustrate what I'm talking about with stovepipes. Stovepipes really mean the tendency of bureaucracies to draw into themselves individual people to look after only their own incentives and not pursue what's in the collective good. It's a big barrier to successful collective action, which is one of the main topics of economics, is to figure out how that can be done. So looking quickly from the left to the right, you see you go from complex situations through different stakeholder groups, the creation of the stovepipes, and then the integration which we need to achieve. Next slide, please. Now I have 5 case studies, which there won't be time to discuss in any detail, but I'll just mention each one briefly so you'll see what we have in mind. We've already seen one case study in today's presentation. Yilin showed how a university working with the state health department could be successful at breaking down stovepipes that hurt individual well owners. The one you're looking at here is from Peru, where you had a similar situation where a city was shirking its responsibility to treat sewage. The sewage, and we had a presentation on this just the other day yesterday at the meeting here. The sewage then impacts these downstream farmers. It hurts their own health, it hurts their export crops, and it has all kinds of negative consequences. The case study can be found in detail at the Global Water Partnership. I have the address on that, or at least the title, down at the bottom of the slide. The Global Water Partnership, the GWP, has published a lot of great cases which can be used for instruction. I should also mention that all of these case studies are ones that I use in my own graduate class at Colorado State University, which I've been developing over a number of years, and increasingly looking at case studies and what we can derive from them in a way of lessons. Next slide, please. This is one that's very similar to what Yilin showed. It's an example of a community water center in California, which is the mitigating institution among farmers and government, different interest groups, that allows some progress to be made despite all of these different stovepipes and incentive structures that the different groups have. Next slide, please. This one is from Egypt, and it's a long-term project that has to do with improving water user associations, which are necessary to collaborate in the distribution of irrigation water, and which can also promote positive health benefits through increased education that occurs through these different water user associations. Next slide, please. This one is an example of urban water service integration through breaking stovepipes down. In many ways, this is the easiest example to illustrate, because in cities, you have these stovepiped agencies for water supply, wastewater, public works, finance, and so on. And one way to break those down is through some kind of a city cabinet that brings the planning function up above the stovepipes of these different separate agencies. Next slide, please. So when you look at all of the different case studies, which I mentioned, you see that they all have common attributes. The stovepipes occur in different ways. I showed different examples of those. They can be stovepipes between irrigators and irrigators. I mean, for example, it's well known that farmers don't always get along with each other, and they may refuse to work together and to achieve collective action. This was one of the biggest gaps in Eleanor Ostrom's research on how to promote collective action among groups without government interference. You have a lot of tools that can be applied, and then the goal is one water in the end there. Last slide, please. So question then would be, what are all of the lessons? Well, there are many lessons. I'll just point to one or two. And then down at the bottom of the slide, you see some great references for case studies, the Global Water Partnership, but also U.S. Water Alliance. Just one lesson that's there, collective action. If you're going to achieve collective action, you're going to have to break these stovepipes. And the way to do it is using all the tools that we have in local site-specific situations in ways that work for everybody who is a stakeholder. So thank you very much, and I especially appreciate this timer on the bottom so I can see what is going to happen. Thank you.
Thank you very much, Neil, for this very interesting presentation and highlighting the role that collective action could play in really catalyzing, breaking down the silos or stovepipes and promoting more collaboration. Are we ready for the Q&A session? Have we been getting questions? I can see some questions have been answered already, Jennifer.
No, but I saw there's only like 3 questions, and I saw Dr. Zhuang answer hers. So they've been answered along the way. So I don't know if there's any additional questions. I actually had a question. I don't know if I'm allowed to, as a co-moderator, to ask a question. But I'm actually very curious about the role of the Department of Health in all of your presentations, because I know after COVID hit, at the World Bank, you know, we support governments heavily to invest in water supply and sanitation on the WASH agenda and water resources more generally. And we thought, you know, when everyone's told to wash your hands, and we said, look, at no water, you can't wash your hands, that this would really, really help and have departments of health and ministries of health really promote wanting to have more investment in water and sanitation and hygiene. And in fact, we didn't necessarily see this. So I wanted to ask all of you, Dr. Sharma, for example, the pharmaceuticals and water, do you see actually the departments of health caring about this? Dr. Zhuang, do we see any health impact? I mean, you talked about risk, but is the Department of Health worried about the health outcomes? And it's the same thing, I think, also, Neil, Dr. Grigg, you know, it's the examples you gave are really important between wastewater from cities affecting downstream users in agriculture. Is there a role of the Department of Health, or is this just something that gets resolved without having intervention from health? And the same thing on the fantastic presentation on disabilities. Nobody wants to talk about access to WASH for people with 15% of the population who have disabilities. So thank you for that research. So that was one question I had to everyone, is like, what is the role really of the Department of Health? Bassel, you might have another question. I didn't see any other questions, so.
I could kick in very quickly. At one time, I was in charge of a regulatory agency, which was the wastewater side, and we were stovepipe. This was a state government level. We were stovepipe from the health department, but one of which had the drinking water. And what I noticed was how narrowly everybody interprets their mission, and bureaucrats are very risk averse. You know, they're worried about a lot of things. So unless they are specifically told that they need to be worried about health outcomes, they're just going to regulate. That's been my experience.
I would like just to share a little bit from the Florida side, because we have a good collaboration with the health department to do this well sampling. So a little bit background story I didn't have a chance to share at my presentation. I've been reaching out, I had been reaching out to local health department. I wanted to do the sampling because just for example, the Marion County, the pilot study, the health department didn't test water. They offer testing like 15, 20 years ago, because they couldn't maintain the testing lab. So all the samples for well owners, they had to send to commercial labs. So I reached out to them, but they were like, we don't have baseline. They have baseline for commercial wells, not residential wells. So a little bit background story was after Irma, I presented that result. The bacteria was 26. Even the sample size was small, but you can see it's 26% bacterial contamination. Then the health department wanted to know more baseline and gave us that grant to enable a 2-year sampling period. And on the, I would say it's they kind of echo what Dr. Grigg just said. Probably they didn't do a lot of education. So from my understanding from like our local health department, they just don't have that much staff to do well water education. They have more other health, like last time I talked to them, they were doing the radon campaign, not necessarily just not that much resource doing the well sampling. That's also how we came in and become a great partnership.
May I see your time is up, Bassel?
Yes, if you have any quick remarks, Virender and Isaiah, just before we move to our next.
They are aware. I'm from School of Public Health. They are aware of the problem, as Yilin mentioned, but then there's no resources because priority of the political leadership is somewhere else. In Texas, about the guns. So that's what's happening. But they are aware of the problem. But unless it becomes a global problem, like it becomes for virus, this will still persist, and it is really major problem. Thanks for the opportunity.
Thank you, Virender. Isaiah, do you have any final remarks before we move to the next section?
Not at all. Thank you.
Thank you very much. Thanks to all our speakers for their presentations, and thank you, Jennifer, for your question. It gives me great pleasure now to introduce our keynote speaker for today, Professor Christine Mo. Dr. Mo is the Eugene J. Gangarosa Professor of Safe Water and Sanitation in the Rawlings School of Public Health and the Director of the Center for Global Safe Water, Sanitation and Hygiene at Emory University. Over her 40-year career, her research has focused primarily on environmental transmission of infectious agents, in particular foodborne and waterborne diseases. She has conducted her field research in many countries. It's an impressive list of countries, including Bangladesh, Bolivia, Cambodia, China, El Salvador, Ethiopia, Ghana, Honduras, India, Kenya, Mozambique, Philippines, Rwanda, South Africa, Uganda, and the United States. Her research includes studies of diarrheal diseases, on-site sanitation systems, exposure to fecal contamination in low-income urban environments, water quality and distribution systems, water sanitation and hygiene and healthcare facilities in low-resource settings, and environmental contamination of vegetable crops. We are really excited to have you with us and are looking forward to your presentation on our topic today. Professor Mo, the floor is yours.
Thank you, Bassel. And good morning, good afternoon, good evening to the participants. My name is Christine Mo. I'm talking to you today from Atlanta, Georgia, in the United States. And I'd like to thank the organizers of the meeting for inviting me to speak to you today. I have been studying water, sanitation, and health for many years. And I'd like to tell you how our studies, especially in the past 10 years, have led us to be concerned about food contamination. Next slide, please. So no doubt many of you have seen some version of this F diagram that shows how fecal contamination from humans and animals can move through the environment through multiple pathways and lead to risk of exposure for a new host. And note that food has a central position in this diagram, and it's connected to the new host by many pathways. Next. For the past 10 years, we have focused our research on how populations in low-income urban settings are exposed to fecal contamination in the environment. And we've tried to examine which of these exposure routes pose the greatest risk. You'll see in this diagram that not all the arrows are the same size. How does the risk of exposure to fecal contamination through drinking water compare to the risk from contact with contaminated floodwaters or ingestion of contaminated food? Next, please. So the goals of our SaniPath study are to identify and describe the sources, movement, and magnitude of human fecal contamination in low-resource urban environments, and to look at the behavior of adults and children that leads to exposure to fecal contamination through multiple pathways. We used multidisciplinary tools and approaches to determine which exposures to fecal contamination pose the greatest risk, and we wanted this information to guide decisions on sanitation policies, investments, and interventions. Next, please. This slide illustrates the different pathways of exposure to fecal contamination that we examine in our assessment. Some of these exposures are through direct ingestion, such as drinking water or eating raw produce or street food. Other exposures are indirect through physical contact with floodwaters or touching surfaces of shared latrines, or contact with open drains, bathing water, touching soil or surface water. We decided to focus on the exposures in the public domain because those are what municipal authorities are able to change. Next slide, please. We've developed what we call the SaniPath tool to assess the risk of exposure to fecal contamination in the urban environment. And the tool collects two kinds of data: behavioral exposure data and data on environmental contamination, fecal contamination. The data on exposure behavior are collected using surveys of self-reported frequency of specific behaviors that may lead to exposure to fecal contamination. For example, the type of water that people drink or the frequency of contact with open drains. Then the data on the locations and the magnitude of fecal contamination in the environment are collected by taking samples from each relevant exposure pathway and analyzing these samples for E. coli bacteria, a common microbial indicator of fecal contamination. These data are then combined to estimate the relative risk of exposure to fecal contamination. Next, please. The SaniPath tool represents a simplified and standardized method for data collection, starting with key informant interviews and transect walks in the neighborhoods of interest to contextualize the assessment. Moving on then to primary data collection through the behavior surveys and collection and analysis of environmental samples, usually up to 10 different environmental pathways, and then analysis of the results and reporting of the results. Next, please. The tool includes a platform that manages all aspects of SaniPath data collection, analysis, and reporting through an online portal. And the tool protocols and guidance are all open source and freely available on our website, sanipath.org. And the source code is available on GitLab. Next, please. A bit more about the outputs of the tool. The tool platform automatically generates the results by combining the behavioral data from the surveys, which are shown as pie charts on the left. So here you see frequency of contact with drain water in the pie chart on the left, with environmental data on the contamination levels based on the laboratory analysis of the samples. So on the right, you see a histogram that shows E. coli concentrations in drain water samples. And then this data is combined with data from the literature and Bayesian analysis to provide an estimate of the proportion of people who are exposed to fecal contamination and the dose of exposure. So the middle figure shows people in red who are exposed to fecal contamination in drain water. The red people are the proportion that are exposed, and the darkness of the red gives an indication of the dose of exposure, which is measured in E. coli, either colony forming units or MPN, most probable number, ingested per month. And this common metric of ingested E. coli per month allows us to compare the risks of exposure from these different pathways. Next, please. To date, we have deployed this tool in 10 countries, in 12 cities, and 50 neighborhoods, as you see on this map. Next slide, please. One finding that became evident in our studies around the world is the critical role of urban agriculture. In many of these cities, we saw farmers growing crops in small plots of green space in urban areas and using wastewater from open drains and canals to irrigate these crops. Our behavior surveys indicate that adults, and to a lesser extent children, in these low-income urban neighborhoods frequently consume raw produce, such as tomatoes, peppers, cucumbers, lettuce, and herbs. Next slide, please. This figure shows fecal contamination levels, or E. coli concentrations, in environmental samples by type of sample and city. So each panel shows the results across, I think it's 9 different cities here for a single sample type. The y-axis is showing E. coli concentration in a log scale, and the different colors are color-coded for the different cities. The units of concentration are colony-forming units, or most probable number of E. coli, per 100 ml for the water samples, per serving for the produce and street food, per swab for the public latrine swabs, and per gram for soil. And we can see here that the fecal contamination levels in these environmental samples vary across the different cities. And if you look in the order from the top, starting in the top left-hand corner, they're ordered from most contaminated to less contaminated water samples. So in the top left corner, you see the open drain samples, which are really the equivalent of raw sewage, followed by flood water, surface waters and ocean water, bathing water, other drinking water, which are usually wells, and then finally municipal drinking water in the bottom row in the left-hand side. And then we also see contamination levels in raw produce and street food. And some of these are highly contaminated. Next slide, please. So here we see a close-up of the same data for drinking water and raw produce samples. And it's apparent that when you compare these 2 pathways of direct ingestion, a serving of raw produce has much more fecal contamination than 100 mL of drinking water in most of these cities. We see that the median produce contamination levels were between 10 to the 2 to 10 to the 4 E. coli CFU or MPN per serving. Next slide, please. So here we combine the data on behavior and the data on environmental contamination, and we look at all of these cities at total fecal exposure and which pathways contribute the most to that exposure. And you see a lot of green in this figure. So the top row is exposure for adults, the bottom row is exposure for children, and you see the names of the 9 different cities across the top. And the green bars are showing the proportion of total fecal exposure that is attributable to ingestion of raw produce, based on the data from behavior and the data from the environmental samples. Next slide, please. Sorry, just one more point from the previous slide is that we saw this across many different cities. Thank you for showing this. So I just want you to see it's not just one city, but across all of these different cities, we saw that produce was a dominant exposure pathway. Next slide, please. So here, just taking a closer look at 5 neighborhoods in Dhaka, Bangladesh, you see that there was no difference detected in terms of exposure by socioeconomic status. So people in the high income neighborhoods and the low income neighborhoods, they all had high exposure to fecal contamination through contaminated produce. And it's worth noting that even though 87% of respondents reported that they washed produce, actually, as we'll see in the next slide, washing produce may only decrease microbial contamination by a relatively small amount. Next slide, please. This is a compilation of research by the International Water Management Institute in Accra, Ghana, that examined multiple methods for washing produce. And overall, their studies found that the log reduction of fecal coliforms on lettuce ranged from 0.2 to 4.7 log 10, with an average of about 2 log reduction using just a cold water rinse, which is what most people do. So given the magnitude of E. coli contamination that we measured on the produce in these different cities, a 2 log reduction is really not sufficient to remove the microbial contamination on an average serving of produce. Next slide, please. So based on our research on these findings, we think that the risks of consumption of uncooked produce are not well recognized, and that the foodborne illness associated with consumption of raw produce is rarely measured in most low and middle income countries. This slide shows data from the US Centers for Disease Control that tracks foodborne illness in the United States. And when the CDC looked at the different types of food that were associated with outbreaks of foodborne illness, they found that most illnesses, 46%, were associated with consumption of produce. And it was also the second leading cause of death associated with foodborne illness. So if this is true in the United States, what does the burden of disease associated with produce contamination look like in other countries where there may be greater frequency and levels of contamination on the produce? So as a water and sanitation researcher, I can tell you that the role of produce contamination or other food contamination is rarely, if ever, measured in studies of water and sanitation interventions. And it's critical that we understand how poor sanitation and management of fecal contamination threatens food safety. Next slide, please. So it's important to recognize that this is a pathway from farm to fork, and that raw produce can become contaminated at multiple points along the supply chain during wastewater irrigation and harvesting at the farm, rinsing of the produce in the marketplace, transport of the produce, and handling during food preparation. So although we found that the raw produce is a universally dominant fecal exposure pathway, the approach to effectively reducing this risk will require site-specific interventions and knowledge about where the food is becoming contaminated and how this is related to sanitation and fecal sludge management. So this illustrates the importance of site-specific in-depth assessment along the food pathway at multiple points, and a demand for further information to determine these critical control points to reduce food contamination and protect public health. I just want to end by, please, next slide, acknowledging, next slide, thank you. The Bill and Melinda Gates Foundation for funding this work, our study team, and the many wonderful partners that we've worked with around the world. And last slide, please. Thank you for your attention. I hope that you'll come and take a look at our website, sanipath.org. Over to you, Bassel.
Thanks a lot, Dr. Mo, for this insightful presentation. And we will have some time for 10 minutes of Q&A, and I'll actually like to start, if that's okay, with a quick question, just to give Jennifer also the time to collect some of the questions that we have in the Q&A box. You provided us a great example of the role of tools and analytics in that can play in assessing the and quantifying the risk of exposure to fecal contamination in urban settings, and you provided different examples of how that was done in different places. Could you talk to us a bit more on the way in which, after we develop those assessments and use those tools, how do we communicate that with the public or with the different decision-making entities? What kind of engagement do you do to translate that science into either leading to different behavioral changes or to different policies across these sectors?
Thank you, Bassel. That's an excellent question. And it also goes back to what Jennifer was saying earlier about the importance of engaging with the health authorities. So when we do a deployment, or when we work with partners to do a deployment, the very first step is actually engaging with stakeholders and understanding what is the information that the stakeholders are hoping to gain. For example, in Dhaka, the World Bank in Dhaka convened the stakeholder meeting and brought together the water and sewer authorities and the health authorities and different representatives from the municipal authorities to understand what were their concerns, which neighborhoods were they interested in, and which pathways were they concerned about. And I think that's really critical. In some cities, they're concerned about street food. In other cities, they're concerned about flooding. In some cities, they wanted a wider range of neighborhoods to compare risks in high socioeconomic status neighborhoods versus low income neighborhoods. So it's important to engage with the stakeholders from the very beginning, but also at the end, when we have results, we go back to the neighborhoods and to the stakeholders and present the results using these visual diagrams to try to make it easier to communicate the results. We think about how do magazines communicate scientific findings to the general public and trying to avoid scientific jargon.
Thank you very much. Jennifer, do you have any questions?
So thank you so much, Dr. That was fascinating. We don't have any questions in the Q&A box, but I'm fascinated by this because personally years ago, maybe 10, 15, 20 years ago, we started the research with the London School of Hygiene, Tropical Medicine, CDC, Emory also, trying to look what were the interventions on the F diagram that really mattered to break the F diagram to not get the fecal matter into someone's mouth, basically, right? Yeah. And coming up with hand washing, the importance of hand washing with soap before ingesting anything as such an important, and it's critical moments, right? Right. And the struggles of trying to do structured observation and observe behaviors, right? It's very hard to ask people surveys. When do you wash your hands, especially before going out to the bathroom, right? People don't want to report on that. But the food element is fascinating. And then maybe following up on Bassel's question, what are the interventions one can do? Is it easier? I mean, obviously around the world, people are using unsafe, untreated wastewater to irrigate. Mm-hmm. And, you know, ideally we could treat all this wastewater and it would not have all these contaminants in the environment. And, you know, that's going to take a lot longer. So on the behavior change side, is the message to people to wash their food better? Is it to not eat raw food and to cook your food? So I guess there's those big, how do you translate the science into behavior change messages that people can understand and are culturally appropriate? I remember in Ghana at one point, we were telling people to wash their hands before they ate their food, wash them with soap before they ate their food, but they like to eat their food with their hands. They didn't want to taste soap, right? So I think it would be interesting to understand, and so what if the implications of the research that you've done, similar to that question, but I'm really curious, do you cook your food or do you wash it, and what do you wash it with to make it clean? That was one question. The other question I had is, I noticed that you looked at public latrines as a source of contamination, not household latrines or toilets. But then you looked at municipal water supply. Did you just take the test of the water from the tap? And I'm assuming quite a few people have standpipes. The post collection, you know, there's always a lot of contamination post source, especially when people have to go collect water and carry it back. I don't know if that was part of your study as well. But these are my questions. Nobody else has asked a question. Let me see if someone jumped in. No, unfortunately not. So.
All right, those are great questions, and I'll try to take them one step at a time. So we started this work doing really in-depth studies, and it was those in-depth studies that then informed the development of this more rapid assessment tool that I presented. But the in-depth studies were done in Accra, Ghana, and Vellore, India, so two different contexts. And we did structured observations. We took samples from the household as well as from the public domain and looked at behavior in depth through structured observations as well as self-reported behavior. And I think some of the key messages here are that different neighborhoods and different cities and different cultures, the risks are different. So even though my message was that food was something we saw everywhere, in some cities, floodwaters were a big risk. In other cities, ubiquitous open drains in front of every house, every alleyway, that was a risk. In some cities, certain parts of Dhaka, the municipal drinking water was a big risk. So I think one important takeaway is that cities and neighborhoods are different. And so that's why you need evidence to make these decisions about how to invest. It's not a one size fits all, as World Bank, as you well know, and we're grateful for the World Bank for being an important partner on this work. So understanding the risks in a city or in a neighborhood is important to inform the decisions, because if you spend a lot of money on an intervention in municipal drinking water, when the big risk of exposure to fecal contamination is through the produce, are you going to really see a health impact? And our lens here is really looking at exposure and public health. So I think that's one takeaway message. In terms of advice to neighborhoods, I think Ghana was a great example, because when we showed the municipal authorities, who are very engaged partners in the work, the results, they have initiated clean food campaigns and clean city campaigns. And the media was an important partner in showing the importance of clean produce and washing produce and good food hygiene. So I do think that there's a lot of opportunities for reaching out and doing public education, education of food vendors, and having the city be an important partner in that. On the household level, when we did the structured observations of young children, one of the highest risks that we saw is that these young children spend a lot of time on the ground, and we were taking swabs of the ground or the floors. They have dirty hands because we took hand rinses, so we had an objective way to measure hand contamination, and they were eating with their hands dirty food. So things that children do everywhere, every day, sitting on dirty ground, eating with dirty hands, eating dirty food, this puts the children at great risk. And big water and sanitation interventions may not address that risk. So a lot of it is understanding the importance of food hygiene, hand washing, and frankly, keeping the fecal contamination out of the domestic and public spaces through better fecal sludge management and sanitation. And your last question, we did sample the municipal water from tap stands in each neighborhood, trying to replicate what people would be getting when they collect it and bring it to their home. Because we saw big differences in some neighborhoods, especially in Dhaka, where some neighborhoods had high quality municipal drinking water and some neighborhoods had quite contaminated municipal drinking water. So I'll pass it back to you.
Thank you. So thank you very much. I mean, I think you made our work so much more complicated. Every water and sanitation, and then now we have to look at food, but obviously this research is fascinating. Bassel, I don't know if there's more questions for Dr. Mo, but Isaiah had his hand up. Did you want to answer?
Yes, Isaiah, did you want?
Okay, sorry. Thank you, Christine.
Yeah, thank you. That was a great presentation. I appreciate the presentation. My concern is what will you suggest for washing of farm produce that are contaminated by fecal issues? Can you hear me?
Yes, Yes,
Okay.
I can hear you, Isaiah. Thank you
Yep.
for your good question.
Yeah.
And I do think, it depends on the context, but at least our findings in Accra, which might be similar to Nigeria, is that you probably need to use a bit of bleach, dilute bleach, when washing produce in order to kill the microbial contamination. So a little bit of chick or bleach in the water, I think would help. And I think raising the awareness, in the marketplace, sometimes people use contaminated water to freshen up the vegetables to make them look clean. But we could provide clean sources of water in the marketplace. We could provide hand washing stations and toilets with hand washing stations in the marketplace so that the produce doesn't become more contaminated through the vendors in the market. So I think there are actions that we could take and public education, and Accra has been doing a lot of that.
Thank you, Asaya, for the question. And thank you again, Dr. Mo, for the insightful presentation and all your experience that you shared with us today. And we're getting close to the end of the session. So I'd like to also thank our speakers today and all the attendees who made it through the session. And I hope that everyone learned something new today. I know that I learned a lot from our excellent lineup of speakers and our keynote this morning. So I'd like to remind you that you can see all of the selection of submitted conference posters online at IWRA-onlineconference.org. The posters will be found under the poster menu. If you have any questions on these posters, you can send us an email to online.conference@iwra.org, and we will contact the poster authors to respond to your queries. With regards to the PowerPoint presentations that you have just seen, they will also be made available soon on our conference website, along with the video recording of the session. With that, I think we're coming to the end of our session today. Thank you, Jennifer, for co-moderating this session today, and hope you enjoy the rest of the conference. Thank you, everyone.
Thank you, Bassel. Great job. Thanks, everyone.
Thank you.